foundation phase. So there are 5 main assessment methods. You have baseline assessment, formative assessment, summative assessment, diagnostic assessment, and screening. So a baseline assessment is to determine what the learner already knows. So a baseline assessment normally happens at the beginning of the year or the beginning of a term, or when you're starting a new theme of work. So for example, here's a baseline assessment for grade R on this side, where you are seeing in the first week or 2 of school, can they print patterns with thick paint, or for example, their physical development. So for grade R, these are the things they would have covered in grade double naught if they had gone to double naught. Here is the grade 2 first additional language checklist. So at the beginning of the term, at the beginning of the second term, you're having a look to see, can they do these elements that they should have covered already in the first term? The next type of assessment is a formative assessment, and this is the main type of assessment that you'll be using in the foundation phase. So formative assessment is assessment for learning. So this type of assessment is focused on the development of the learner. So this enhances the day-to-day teaching and learning, and this is going to be things like your worksheets that you do every day and your classwork. Here's an informal assessment example where it's a checklist regarding handwriting. Next, we have summative assessment, and this is for assessing the competence at the end of a specific unit or piece of work. So it's not emphasized in foundation phase. However, it's slowly introduced into grade 1, and then more so in grade 2, and more so in grade 3 to get them ready for grade 4. So here is an example of a formal test where they would actually write some words in the block as their summative. So it's the end of the work, and these are normally the tests that count for the most amount of marks, and then this mark would go on the report. Then you get diagnostic assessment, and diagnostic assessment is used to identify learners' strengths and weaknesses. So it assists teachers to gain an understanding of the situation, to gain an understanding of how potentially you could help the child improve and the required resources needed. And then the teacher can take action, and this action should improve the learning outcomes. The last type is screening. So screening is done to determine the readiness of a learner. So the most relevant one for foundation phase is something called a school readiness test. So often students will have to do the school readiness test at the end of grade R before a school will accept them for grade 1. And this is just to make sure that they're ready for the formal school environment. Screening can also be done by a specialist in terms of an educational psychologist or an occupational therapist to identify any potential learning disabilities.